Two royals, two concurrent hospital stays. What exactly is going on with Catherine, Princess of Wales, and King Charles III, and what sort of recoveries are in store for them? According to an official notice from Kensington Palace, Kate has stepped back from her public duties until after Easter to recover from a planned abdominal surgery. Although the palace shared little about Middleton's medical status, multiple outlets have reported that the surgery was a success and not for cancer. That said, she still has a 2-week recovery ahead of her. According to TMZ, Middleton made her last public appearance at Christmas 2023. As E! News reported, Middleton is currently residing at the London Clinic, an upscale medical facility that's certainly fit for the future Queen of England. Meanwhile, King Charles is set to check into a hospital next week for treatment. A statement from Buckingham Palace read in part, "In common with thousands of men each year, the King has sought treatment for an enlarged prostate. Fortunately, the King's procedure is not related to cancer either." The statement continued, "His Majesty's condition is benign and he will attend hospital next week for a corrective procedure." Although the recovery time for the procedure is unknown, it's been reported that he will still be able to carry out his royal responsibilities. The concurrent hospitalizations have stirred up worry in royal watchers.
This is serious surgery that the Princess of Wales has clearly undergone.
Quite unprecedented. I've never known anything like this before.
The London Clinic has a long history of treating VIP patients, such as the royal family, John F. Kennedy, and Elizabeth Taylor, the Daily Mail notes. The hospital also treats normal citizens, at least the ones who can afford it. As Hello reports, Middleton will probably have a very upscale experience. Middleton will also be able to make use of the hospital's patient concierge service, which helps patients plan their post-stay festivities. That said, Middleton already has a private staff on call, so the service may actually be a bit redundant. Where King Charles will be hospitalized hasn't been made public, possibly due to security concerns. However, the Daily Mail has reported that his hospital stay will likely amount to an overnight visit. Charles also reportedly received his enlarged prostate diagnosis at Balmoral Castle shortly before Buckingham Palace announced the news. The King's immediate engagements have been cancelled for the time being. Prince William, meanwhile, hasn't completely stepped back from royal duties, but he won't be increasing his engagements to make up for Kate Middleton's absence. People reports that William has decided to scale back his public engagements to be present for Middleton and their 3 young children. News photos also show that William has since visited his wife in the hospital. Kensington Palace confirmed the nature of William's visit, stating, "The prince has just left hospital after visiting his wife." Although William has not spoken directly to the media, royal commentators have theorized that the Prince of Wales is experiencing some stress over Middleton's procedure, which took place just days before his father planned to check himself into the hospital. Royal expert Jonathan Sacerdoti told Fox News, "For the Prince of Wales, it will be a stressful time having both his father and wife in the hospital. Just like anyone else, the health and well-being of close family will be a concern for him." Prince William's decision to stand by Kate Middleton as King Charles prepares for his hospital stay means that 3 of the most prominent members of the royal family will be out of commission for the immediate future. According to the Daily Beast, the royal family isn't exactly in dire straits, however. Although Prince Harry and Prince Andrew still hold their Counselors of State titles, which would allow them to step up if the king were deemed medically unable, there's still a crop of royals who would come before Prince Harry, who's been publicly estranged for years. Meanwhile, Prince Andrew has been dealing with the fallout of his alleged ties to Jeffrey Epstein and would be another unlikely choice. Hopefully, King Charles can quickly jump back into royal duties after his procedure, as multiple outlets have reported. In the meantime, Camilla Parker Bowles, who hasn't announced plans to postpone her public engagements, has given an update on Charles. After commenting on the frigid temperatures in Scotland, the Queen Consort, who is currently heading a domestic violence initiative at the Aberdeen Art Gallery, took a moment to speak on Charles's health. People quoted her as saying, "He's fine, thank you very much. Looking forward to getting back to work."